So this lady's about 3 months out from a blepharoplasty and a fat grafting, but I want to sort of walk you through what I did for her and what are the component elements towards success. I also did a lip advancement for her lower lip and a lip lift for the top lip. And so the things that I've done for her from a surgical perspective are those things. So you can see that the volume is better, the brows are filled in. She did not need a brow lift, and I did, blepharoplasty. I've done all of those elements to make her look better, but the component that I'm actually going to share with you here is more about her skin, an area that you may have overlooked when you look at this. So I didn't do a facelift for her. She could benefit from a facelift, but what I managed were two things that I want to show you. So the first one is, it's hard to see this. I probably will have to repost a separate one where I blow it up a little bit more. But if you take a look at her skin, she's got multiple satellite lesions all over her face, little bumps all over the place. And when I first met her, she said, "How can I manage that?" And I said, "You really need mesobotox." And if you really look at the before and afters, which again, I probably have to blow up on a separate post, they're significantly smaller and her texture is better, everything is better. And how do you do that on a black woman without risk? You can't do that with a laser or chemical peel or even cutting it out. There's very risk of hypopigmentation, unusual scarring, hyperpigmentation, a lot of risk with that. But you can see the texture, the lesions are improved. And the second thing I want to show you is that there are multiple creases around her mouth and her folds. And those areas are improved with a dynamic filler, a filler where I'm actually lifting the crease up without adding undue and unwanted volume. If you're used to fillers around the mouth, you know they don't work that well. You know that they actually add a lot of bulk into the lower face and you're spending 3 or 4 syringes and you're still not solving the problem and you're just getting unwanted bulk. With this technique, I'm actually able to lift the crease of the folds up both statically and dynamically. In fact, she's got an amazing dynamic treatment where there's like 6 wrinkles down here when she smiles that it's eliminated. I should show that in also a separate post as well. But that is the amazing thing, is that in all skin types, how would you do that if you were a white person? Well, you would say, okay, you could maybe laser that, but it still won't fix it. But in a black person, you have even fewer options. And the great thing is my same technique I'm using for a white person is what I do for a black person. And these fillers, you can't fix these creases with a facelift. You can't fix these creases with a fat graft. You can't fix these creases with a laser, but you can with a very, very targeted filler called a dynamic filler. And so this whole post is not about how I've managed her volume or how I've managed her lips and aging. I'm really talking about how have I really complemented the result by targeting the skin. And that's the concept here, which is mesobotox and dynamic fillers.